Hello friends, myself Dr. Prakash Swain. I'm a consultant radiation oncologist at HCG Panda Cancer Hospital, Cuttack, Odisha. Today I wanted to discuss regarding the role of radiation in cancer prostate. As we all know that prostate cancer is a cancer of elderly males beyond 60 years. The prevalence of getting a prostate cancer is extremely high, and it's a hormone dependent cancer, specifically the testosterone. Under modality of treatment, we always do the management of prostate cancer with starting with hormones if required, then followed by either radiation, chemotherapy and surgery. And all these modalities have great depth. So, and which patient requires what sort of treatment, it depends upon the stages of patient, and more importantly now what we rely on is the risk stratification. We have to understand the life expectancy of the treatment, the benefit and side effects we incur by going ahead with a certain type of treatment. So my focus is to explain about the role of radiation in case of cancer prostate. Prostate cancer, as we all understand, either we get majority of the prostate cancer through surveillance, and these patients we identify them at an early stage 1, maybe low risk, low intermediate risk, favorable subgroups. So those type of patients, they can have a very good outcome with only a very focused and precision radiation therapy. And for advanced cases or intermediate unfavorable cases, low risk cases or oligometastatic conditions, we understand there the life expectancy is little bit lesser, and but still these patients have a very good life expectancy to expect. And in those cases we give combinations of therapy, it's multimodality therapy. So role of radiation is still important in these conditions. Now coming to radiation, that difference of palliative radiation versus radical radiotherapy versus still precise, the most precise form of radiotherapy which we give in prostate cancer, being it stereotactic ablative body radiotherapy, or in some cases, some very limited and specific cases, we do employ brachytherapy, interstitial brachytherapy or seed-based brachytherapy, permanent brachytherapy. So, looking into these different forms of radiation, we all types of radiation can be used in any in majority of the patients of carcinoma prostate. Prostate radiation has actually evolved very rapidly over the last few decades. The reason being the precision we have got in our radiation techniques. The life expectancy has increased due to use of other modalities of treatment like chemotherapy and hormone therapy and targeted therapies. So what we used to treat a few decades back was only conventional radiation with 3D CRT or maybe intensity modulated radiotherapy. But what we are looking towards now is using hypofractionated radiotherapy. So hypofractionated, the benefit of hypofractionated radiotherapy is that the treatment finishes very early, and patient compliance are very good. Patients have very good lower urinary tract symptoms control, and the biochemical control is also extremely robust. And what we are now doing most often, or try to do in most cases, is stereotactic body radiotherapy. That is, in such cases, the treatment finishes in very soon, a week or two. So patients' compliance is very good, and the biochemical control and the radiological control is extremely satisfactory. So this is what we are doing more nowadays, and with very good results. So I would like to summarize that in carcinoma prostate, the role of radiation therapy is immense, and it's definitely all the patients of cancer prostate get a very good life expectancy out of, and with a limited side effect profile, they get a very good outcome. So thank you.